Greece, 450 BCE. Few people are aware that the Hippocratic Oath also contains this essential vow.
I will respect the hard-won scientific gains of those physicians in whose steps I walk, and gladly share such knowledge as is mine with those who are to follow.
But that was the philosophy then. Wind the clock forward to the present day, and what is it like now? Imagine this. You're working in a busy hospital. You're a junior doctor, and there is chaos all around. You barely have time to think. And then it happens, your worst nightmare. A patient is unable to breathe, and the nurse hands you a scalpel, shouting, "We called for help, but there's no time. You need to do a cricothyroidotomy now." And then it hits you. That realisation that you have never done one before. In fact, you've never even seen one before. The room feels stark, you start to sweat, and you find yourself out of your depth. But the patient's life depends on it. If only you had had time to practice it before. Everyone needs to learn, and actually, many of us like to teach. And many people are teaching. They are innovating. They are trying out new technologies. I guess you could call them the early adopters. But do we know who is doing what and where? Are the trainers getting their message out to the right trainees that need it? Are trainees getting to practice when and where they want? The practice they often desperately need. Wouldn't it be great if expert trainers could create simulation content that was accessible by trainees all over the world? If trainees could watch their progress on simulation in their own time, giving them the confidence to take on clinical challenges and not feel out of their depth. If trainees from all specialties along the patient pathway got the opportunity to learn and share their learning with each other, wouldn't patients benefit from such a collaborative team? What if we could map who is doing what so we can identify and support all those trainers and trainees who love education?
Imagine if it was easy for us to learn from each other, regardless of where you are in the world.
We believe the best way to get high quality learning is to empower the teachers. Give them the tools to teach their skills their way. Quality will take care of itself.
No one wants to feel out of their depth. I know, I've been there as a junior doctor. But technology is changing things. Suddenly there's a device in your pocket that can battle all those fears. Now you can practice things that worry you whenever and wherever you want.
Trainees need to learn, and seniors love to teach. It's in our blood. What if we made education more accessible for all? Wouldn't that change the world? AMODISC. Making education accessible anytime, anywhere.